Becky Rinchuso. I'm an RN clinical manager for our Baptist Home Health Network Customer Service Department here in Little Rock. I've been employed with Baptist since August of 1985. Many years ago, I was told by numerous family members as well as some city leaders about the role that my family played here at Baptist Little Rock. Back before the days that Baptist was here on Lyle Drive or Medical Center Drive, my mother then was city clerk of Little Rock, and the mayor flew to New York to sign bonds for the facility as it is now. It was basically they wanted to build another facility out in the woods, way out west where no one lived, traveled, and they Baptist Little Rock saw the vision of expansion to provide the optimal level of care for all the patients that they could serve. Several years ago, my cousin that was here in the hospital had told me that he played a role as the contractor for Baptist when they were building the facility. And he was the one that built some of the patient rooms and all of the closets, the shelving, that sort of thing. And he was a commercial builder and had built a lot of the commercial shopping centers around town. And so that gave me more sense of pride, not only as being an employee, but also of what my family did to make Baptist what it is today. My 3 sons were all born here and attended daycare over at Baptist, which was a big value. And we all treated each other like family. And now my granddaughter is following in their footsteps, being born here as well as attending daycare. And it's like family all over again. So there's a sense of pride, family. It's an amazing facility to be at and to work at. And to see the patients come in here sick and be able to leave here, to help transition them to home with home health, to see their wonderful outcomes that they do have. The couple of the memories that I have of Baptist is when MedFlight first came. And we had the flight nurses, and I had a patient that was on 5A that was having to transfer because they had to have more intensive care at a specialty hospital out of state. And so I was preparing that patient to make that transition because they were really acutely sick. And so I was trying to help that patient get everything that was needed, make sure they had their medications given, that sort of thing, so that whenever it came time to transferring them from that bed to the bed that they'd be on in the helicopter, that to me was very memorable. The MedFlight director even sent a letter to my supervisor then, Sue Glover, thanking me for what all I did for that patient to help ease that transition. I was even here when our first heart transplant was here, and dealing with our first heartmate, and even having that first heartmate go home with home health. That has been a big thing for me, as well as back in the day when I first started, my first big-time patient I took care of was a former governor. And so I had a sense of pride with that, taking care of those type of people and kind of getting to know them, and taking care of them and seeing them being able to leave the hospital.